Hello, I'm Diego Hernandez, and I'm gonna talk about the side effects and complications of intraosseous anesthesia and conventional oral anesthesia. This article was written by David Peñarrocha, Javier Ada, Maria Oltra, Maria Peñarrocha, and Miguel Peñarrocha. This was written under the journal section Oral Surgery Publication Types Research in May 2012. This article contains the side effects and complications of both intraosseous anesthesia IA and conventional oral anesthesia. In order to deeply analyze it, we'll compare the results between each other. The study was carried out by a simple blind prospective clinical study. Each patient underwent two anesthetic technique IV and conventional. The two operations were similar and affected the same two teeth in opposite quadrants. Heart rate was recorded in all cases before injection of the anesthetic solution and again 30 seconds after injection. The complications observed after anesthetic administration were recorded. Here at slide number 5, we can take a look at different types of anesthetics. Here, the conventional one and the intraosseous. With the intraosseous anesthesia, IA allows direct placement of the anesthetic solution in the cancellous bone adjacent to the tooth programmed for anesthesia. Since the anesthetic solution is targeted directly to the tooth requiring treatment, the surrounding soft tissue are usually not affected, unlike the conventional one, in which a local infiltration and locoregional anesthetic blocks. A total of 200 oral anesthetic procedures were carried out in 100 patients. Each patient was subjected to both anesthetic techniques. A 7-day interval was established between the two procedures. Anesthesia in all cases was carried out by the same operator. The inclusion criteria were established. For example, patients should be between 10 and 50 years old. The medical history was taken into account, so patients shouldn't have diabetes, heart disease, high blood pressure disease. Patients shouldn't take any medication at the time. The absence of oral of soft tissue infections, and a confirmation of pulp vitality using thermal and electrical tests. The exclusion criteria were periodontal, pockets, or tooth mobility, radiological alterations like bone loss or preapical radiotransparencies, as well as any type of third molar treatment. The remarks in this study. So heart rate was recorded in all cases before injection of the anesthetic solution, and again 30 seconds after injection. The side effects and complications observed after anesthetic administration were recorded both during the dental procedure and 7 days after surgery. Discomfort and/or problems opening or closing the mouth, as well as post-anesthetic biting problems, were recorded subjectively by asking questions to patients 7 days after the procedure. The anesthetic types used. So, first of all, for conventional anesthetic, a spy-check syringe was used, made for Laboratorios Inibosa, Barcelona, Spain, with an auto-aspirating system and a 25mm injection needle. An in turn was carried out using the stabilizant system. Fairfax Dental Inc., Miami, Florida, USA, following the technique described by Galatsi. The anesthetic solution used in the conventional procedures was 2% lidocaine with 1 to 100 adrenaline, octocaine 1 to 100, Laboratories Clarben, SA, Madrid, Spain, while IA was carried out using 3% mepivacaine without vasoconstrictor, Laboratories Norman, Madrid, Spain. So here in slide number 5, we can take a look at the differences between IA and conventional anesthetics. So for this, a heart rate, pain, pharmacist, and dosage and technical were taken into account for making the comparisons. The results of the study shows that both anesthetic techniques significantly increase heart rate. IA caused comparatively more pain at the injection site. Limited oral aperture was more frequent with conventional anesthesia. Both anesthetic findings showed no significant difference between the two techniques. In my personal opinion, I've got to say that the use of intraosseous anesthesia technique should be implemented more because it is a great advantage to use less pharmacological doses. Likewise, techniques should be developed to make its applicability easier to use. Thank you so much.